This meeting is being recorded.
Good morning and welcome to Medical Insurance Monday. I hope everybody had a really good weekend. I did, but I look at it and go, where did it go? It goes by so fast, doesn't it? I have a couple of announcements. First of all, our Wednesday, Wednesday class will be moved to 11:30. So that we have a long period of time where we can really dig into Z codes. Z codes will be our subject matter for Wednesday. I want to remind you that we have a Zoom class on Thursday at 4, and I believe Miss Crystal will be the one who will be hosting that meeting. I want to say how awesome I felt after seeing all of you guys or a lot of you guys on our last Thursday, and you were participating. Y'all, I just want to say, as soon as you guys hung up, all the instructors called each other and were like, oh my goodness, that was so good. We get so excited. So, and you can see how we bounce off of each other in class. We're like that in real life too. So it's just exciting for us to have you guys together and participating, because instead of shrinking back, you guys got right into that, and we love that. July the 4th, which, where did June go, right? July the 4th is coming up. It's a Tuesday. We have no school July the 4th. I am taking July the 3rd, the Monday, off. So I'll be off Saturday, Sunday, Monday, and then we're all off on Tuesday. That does not mean that you can't get a hold of me, but I just there won't be a class that morning. And I won't be like in my office, even though my office is in my house, and I probably will be in my house. Y'all understand, I'm taking a personal day off. This is the first time I've ever done that. I've never utilized my time off, and this year I feel old. So having those extra days off helped me so much. So, oh, here comes somebody on their phone. Hello, iPhone. All right, we're going to go ahead and share the screen. Do you guys remember, we were out last week, but the week before we talked about HMOs and PPOs? Well, this week we're going to be talking about workers' compensation, CHAMP VA, and Medicaid and Medicare. So, and I know that you guys have had some lessons on Medicare, but we're just going to review that. So let's go. So does anybody know what workers' compensation is? Stacy, what's workers' compensation? You're on mute, sweetheart. It's okay, I do it all the time.
It's if you get injured or hurt on the job, they cover medical expenses for your injuries, rehabilitation, lost wages. My dad was in an 18-wheeler wreck, so it paralyzed him from the chest down. So workers' comp paid for everything for him, even all the way. They even paid for him a house because he had to have a wheelchair accessible house.
Well, I'm so very sorry that happened, but I think it's awesome that they took care of him. I think that's awesome.
Oh, yeah.
So what is workers' compensation? Workers' compensation is insurance to provide benefits to employees who are injured or become sick while performing the duties of their job. These benefits can cover medical expenses, lost wages, rehabilitation, and in the event of death on the job, death-related costs for the family. So that's basically what Stacy just said. So let's do a question right off the bat. So you may not know these things, but we're going to talk about the question. And as you guys can see, this was at, it says number 40, and then it's got the little, one was at the bottom of the page and the other was at the beginning of the page. So that's why it looks funky and weird. Which of the following information is required to submit a workers' compensation claim? Okay, so let's think about it in the workers' compensation mind. When the workers' compensation gets a claim, they want to know, when was this person injured, right? So A says date of injury. So that's going to be one. Do y'all agree?
Yes.
Yes.
B says employer's name. Who does the workers' compensation insurance? Sorry, y'all, the weather just got really, really bad here. So I just jumped out of my skin from the thunder. So whenever we send out a claim, the employer has a contract with workers' compensation insurance. So we have to send the employer name, right? We have to. So date of injury and the employer's name. Group insurance, does that have anything to do with workers' compensation? It does not. So we're not doing that. Employment status. That doesn't matter either. Obviously, if they're doing a workers' compensation claim, they're employed by the company, right? And the last is employer's address. How do they know where to send the money to, or, you know, correspondence they need with the employer, which is that contracted with worker compensation? So your answers are date of injury, the employer name, and the employer's address. Which of the following must be included when completing a CMS FIP form 1500 form for a workers' compensation case? All right. A 1500 form is only a claim form, and I'm going to be showing you one in just a minute. But again, it's going to go back to what we just talked about. So we need to pick two. A, the place of employment. B, the length of employment. C, date of injury. D, patient's primary insurance information. Or E, employer's liability insurance information.
I say C for sure again, but I don't know if I would do it again, but. I don't know if
Well,
that's right.
yeah, we're not talking about the first thing. We're just talking, this is a new scenario. We definitely need the date of injury.
Okay.
Okay, so I see two that I'm going, oh, what would I do? What do I think? The place of employment
Yeah.
or the employer's liability insurance information? Let's think about it. Workman's compensation has a contract with that employer. If they have the place of employment, the employment name, they know what the information is already. So what do we need? The place of employment. It's basically the employment name. Who are you employed by? Do y'all agree?
Mm-hmm.
I thought
Yes.
doing A or E, that's, you know, that's kind of tricky, isn't it? But let's just make it very, very simple and then think about it in a simple way. If I'm going to, I'm not even going to think of an example because I confuse myself sometimes. Let's just move on. Okay. Workers' compensation policy guidelines are determined by the federal government, state government, OSHA, or the employee's human resource department. Now, I see two that we can take out automatically. Is there one that you guys know that we can just take out?
A and B.
A and B? You would take out A and B? I wouldn't take out A and B.
Okay. Because I was already thinking C. I was thinking it was.
Yes, C is right. Don't second guess yourself, Abigail, because when you do that, don't second guess yourself.
I know.
So
I
we're
was
going to take out C. OSHA is for building safety, you know, hazardous waste, hazardous chemicals, things like that.
okay.
The employees' human resource department, do they determine anything to do with the contract with? No, they don't.
Okay.
Now, that leaves the federal government or the state government. I'm just going to go ahead and tell you, it is individual for every state.
Okay.
It is the state government. I wish I could find a way to find a relatable lesson to go with that. And I looked and I can't. So I'm just going to tell you the answer and we will review this question again. And you guys will remember. Workmen's compensation policy guidelines are determined by the state government. Okay, the next one. Who is the policy holder of a workers' compensation policy? The employee, the injured, the employer, or the government? Who does workers' compensation have a contract with?
C, the employer.
Absolutely right. C, the employer. Very good. Okay. Now, we're going to talk about this. I don't want to, because it's a lot of words, right? But let's just not get bogged down by there's a lot of words. The patient was hurt at work and seen in the physician's office today. The patient is covered under Medicare, and Blue Cross Blue Shield is also covered under workman's compensation. Wait a minute. The patient is covered under Medicare and Blue Cross Blue Shield and is also covered under workman's compensation for this injury. Which of the following is the primary insurance and secondary insurance? Okay. So it's already telling us he's covered. He was hurt at work, right? He's covered under workman's compensation, Medicare, and Blue Cross Blue Shield. What is going to come first when we bill?
Workers' comp.
Very
Workers'
good. Workers' compensation. What would be second, just because it's listed this way? We don't,
Medicare.
huh?
Medicare.
Medicare, that's right. So workers' compensation is going to be primary and Medicare is going to be secondary. C. And the reason that we chose that one is because that's the way they have it listed in the scenario, that Medicare, the patient's covered under Medicare and Blue Cross Blue Shield, and because he was hurt, he has workers' compensation. Whew, trying to all of that without taking a breath. And so because it's listed that way, we automatically think without the workers' compensation, without being hurt, Medicare would be his primary. So makes sense?
Mhm.
Okay. All right, can you guys see this? This is a CMS 1500 form. If you look where the red arrow is, this is where if you had to hand fill this out, which I have to tell you, in my career, I have probably did 10 in 4 years. It was never for workman's compensation. It was always for Medicaid. Sometimes United Healthcare is a difficult insurance. I'm just going to say that. Okay, so if you look at 14, date of current illness, injury, or pregnancy, LMP. So this is where your date of injury would go. Name of referring provider, just additional claim information, but this is where your workman's compensation would be listed. I just thought y'all would be curious about that, so I put it in. Okay, the next thing we're going to talk about is CHAMP VA, CHAMP VA, however you want to say it. I've always said CHAMP VA. I just always have, maybe wrong. So it's Civilian Health and Medical Program of the Department of Veterans Affairs. It's a mouthful, right? Well, we know it pertains to veterans. The government's health insurance program for veterans with 100% service-related disabilities and their family. Healthcare expenses are shared between the Department of Veterans Affairs, which is the VA, and the beneficiary. No, I'm gonna keep my personal opinion out of that. I wanted to go back and talk about it, but I'm not going to. We're just gonna say that's what it is. So what is Medicaid? Do you guys know what Medicaid is? Let me ask this. What is Medicaid based on?
Income.
It is based on income. So Medicaid is the nation's primary health insurance program for low-income children, families, seniors, and people with disabilities. We don't have to know anything else about Medicaid. Just that very first bullet point. And it's based on your income. I'm gonna take a sip of coffee. So let's go over our Medicares. I know we've gone over them. We're going to go over them again and again and again. You're going to remember. It's going to be just like that to you. So hospital coverage, Part A. Inpatient care in the hospital, skilled nursing care, hospice, limited home health care services. Medical insurance, Part B, Medicare. Doctor visits, outpatient, certain tests and screens, screenings, flu shots, mental health care, alcohol use counseling, chemotherapy, physical therapy, and diabetes screening. Part C includes all of Part A plus B and additional benefits. That's where you go in and you're able to choose your package. What exactly do you want to be covered under A? What exactly do you want to be covered under B? Vantage is a Medicare Advantage program. And then Part D, prescription drugs. I want to stop and tell you a quick story about a student I had. Her name was Lucretia, and she was wonderful. Bless her heart, she had in her head that Part D Medicare meant dental. And one day in class, we were going over something much like this in actual lesson when we were on ground. And I said, okay, who knows what Medicare Part D stands for? She's like, I know, Miss Marcia, it's dental. And she was so proud of herself. And I had to say, oh, I love that idea, but no, it's drugs. She was like, oh yeah, it is. And I told her recently, every time we go over Medicare Part D, I still tell that story. Okay, so you are filing a claim for a hospital stay for a patient. The patient has Medicare Part
A.
Part A. Which of the following statement is true for an employee on Medicare if he chooses coverage under the employer's group plan? Claim should go, which of the following statements is true for an employee on Medicare if he chooses coverage under the employer's group plan? Claim should only be submitted to Medicare. Is that true? Stop and think about it. No.
C.
Go ahead.
I think it's C.
See, the group plan will be primary and Medicare will be secondary. That looks like a great one. Let's just read the others. The group plan will reject coverage and Medicare will pay 20%. Claim should only be submitted to the employer's group plan. I think Victoria is absolutely right. Do you guys agree? The group plan will be primary and Medicare will be secondary. Okay, let's review. So let's look at HMO. We're going to just hit on that for a second. So when we're talking about an HMO, it's primary care physician, referral, then specialist. Do we remember that when we close our eyes? PCP, referral, specialist. PPO, no primary care physician or specialist, no referrals. You can just go with your PPO. You do not have to have a referral. Okay, so for next week, when you have time, I would like for you to review these terms: copay, coinsurance, deductible, referral, prior authorization, and then pre-certification. Do we need to go back over those words again? Copay, coinsurance, deductible, referral, prior authorization, and pre-certification. Everything we do next week will be based on those key terms. Those key terms are absolutely necessary for you to understand. Any questions? No? Well, did you guys enjoy class? Did you learn something?
Yeah,
Yes.
Feel better about workman's comp, right?
I know a lot about workers' comp.
I could tell. The biggest thing to remember again is who's the employer that holds the contract with workman's comp and what's the date of the injury. Those are just, just like HMO, when we talk about that, we're just pulling out those key things to help you remember. It doesn't have to be complicated to help you remember things. So Thank you so much for attending class this morning. Tomorrow is Terminology Tuesday. And I have to tell you, I'm having a rough time because I want to show y'all every medical term known to man. I just want to show all of them to you. And I want to play with all of them so that we can get to doing exercises and pick them apart. But we can't do that. That just gets too confusing. So tomorrow for class, I would like to ask for you to have your CPT manual ready. And that is the gold manual, the gold and white. And
She ate it?
we're not going to be coding in that, but I want to show you where medical terminology is found in that manual so you can always remember where to go if you can't remember. All right, everybody, have a good day.
You too.
Thank
See you
you.
tomorrow.
Bye.
Bye.